Hello, this is Tony Breitbach, and I have the privilege of serving as the president of the National Academies of Practice. Let me personally thank you for being a new member, whether you are a fellow, professional member, or an associate member. Every member is a valued part of our group of colleagues. I really thank you for taking the time to apply for membership and to follow through and congratulate you on this great honor. Today, we are going to walk you through a little bit of an orientation for the National Academies of Practice, and we're going to take you through the brief history of NAP, and talk to you a little bit about our vision and mission, our core values, and our organizational structure. Then we'll talk a little bit about a great opportunity for you to get involved with the National Academies of Practice through the Strategic Interprofessional Initiative. Also point out some publications and resources and give you ways to stay informed and get involved. And we are very excited about the 2026 forum in Indianapolis. When you look at NAP, NAP was founded by Dr. Nicholas Cummings, a psychologist, in 1981. And the Psychology Academy was the first to form, and nine more followed. Really, the goal of setting up NAP was really to provide a group of experts that can advise the development of policy and initiatives moving forward. In 1982, the first Distinguished Practitioner Fellows were inducted at the National Press Club in Washington, D.C. during a historic black tie event. In 1982, NAP was recognized as a nonprofit. In 2014, the NAP added 4 new academies: audiology, occupational therapy, physical therapy, and speech language pathology. In 2017, the professional membership category was developed to give newer, younger members the chance to be involved with the National Academies of Practice. In 2021, NAP added My Academy, the Athletic Training Academy. And then following that, we revised our vision and mission in 2022 and added a Respiratory Care Academy in 2023, Nutrition and Dietetics in 2024, and then our most recent academy is the Public Health Academy in 2025. The vision of the National Academies of Practice is to be the alliance of professionals collaborating to transform health and well-being. And our mission is to advance interprofessional education, scholarship, research, practice, and public policy by educating and informing our members and others, facilitating collaborative scholarship and research opportunities, recruiting, engaging, retaining, and mentoring our network of members, and advocating the value of interprofessional practice and improved healthcare and policy for all. We recognize together we have some shared values. Those are collaboration, patient-centeredness, inclusivity, and interconnectedness. Like I talked about earlier, we have 17 academies listed here, and we are proud to recognize them all as members of NAP, and we like to speak with one voice, one interprofessional voice, when we make public statements. Our executive committee is comprised of myself, the President-elect Dr. Tricia Thomas from nursing, immediate past President Dr. Andrea Feitball from physical therapy, Secretary-Treasurer Dr. Victor Bray from audiology, and then our vice presidents, John Conry is our vice president of interprofessional collaboration, Mark Taub is our vice president of membership, Julie Maxworthy is our vice president of partnerships and networking, Terry Kennedy is our vice president of public policy, and Lynn Williams is our vice president of professional development. And you can always visit the NAP website for the most up-to-date list of council members and photos. So our NAP council is made up of a chair and a co-chair of each of our 17 academies, along with our executive committee and our leadership. We are indeed very fortunate to have an outstanding support staff from AMR Management Services. Our executive director is Melanie Bowser, and our project coordinator is Kayla Fuller. You probably already have heard from both of those so far. AMR is led by our liaison, Tracy Tucker. And then additionally, you'll be seeing at the forum Hillary Wicks, who's the Education and Events Manager, and Catherine Pauley. She is the Member Services Coordinator. We have several committees that really do the work of NAP. We have an awards committee, which recognizes deserving members with our annual awards. We have a finance committee that works with the Secretary Treasurer to manage our finances. Forum planning is a subcommittee within the professional development committee, but as you can imagine, the forum is such a big undertaking that it acts as a standalone committee. Interprofessional collaboration is our newest committee that was really designed to house the strategic interprofessional initiative and allow members to create unique work groups to work on specific tasks around interprofessional education and practice. Our membership committee is responsible for recruitment and retention and managing the membership process. Partnerships and networking work together to work with sponsors, partners, and build networking opportunities. One of the things we're very excited about this year is the Communications and Marketing Task Force is getting blended in as a subcommittee in that committee. Professional development is responsible for many activities and education for our members and professional development. Public policy, as we said from the very beginning, NAP's main focus has been public policy and advocacy, and we have a very strong public policy committee, and we do yearly Hill visits, and we are engaged with policymakers and monitoring public policy throughout the year. I'd like to talk a little about the Strategic Interprofessional Initiative that was developed in our last strategic plan to basically put our interprofessional values in practice for our members. Our key deliverables are we wanted to create a culture of cross-academy collaboration and have projects that demonstrate the impact of interprofessional collaboration to address the social determinants of health. We utilize as a foundation the recommendations of Healthy People 2030. You want to consider volunteering for one of these 4 working groups, and they're based around several of the Healthy People 2030 priorities: health communication and health literacy, overall health and well-being, evidence-based screening and prevention, and healthcare access and quality. If you look at the Interprofessional Collaboration Committee on our website, you can get examples of all the outstanding projects that have been coming out of that committee in the last 2 years. NAP has several useful publications and resources for the members and our public. The Journal of Interprofessional Education and Practice is the official journal of the National Academies of Practice. And as a NAP member, you get complimentary access, full access to that journal. Position statements, white papers, and comments are commonly developed by our committees and leadership, and those are posted on our website. We have an interprofessional education and practice lexicon that identifies key terminology and that is updated regularly and posted on our website. Please use it as a resource. It's really, really useful. Our public policy and advocacy group developed a telepractice toolkit that really was very valuable during the COVID pandemic and continues to be updated and used to this day. Our bylaws are posted. The NAP Times, which is our member newsletter, is also available, and many, many more resources on our website. The best ways to get involved with NAP is to stay informed. You will receive the NAP Times monthly, and we also have quarterly town hall meetings that most often involve breakout rooms where you can provide input on our directions that we're headed as an organization. The NAP website is actually going to be getting an update through our communications and marketing task force this spring, and we're looking forward to updating that great resource for our members. You want to participate in academy meetings. Basecamp, if you are on committees or in academies, you'll have access to Basecamp. And our social media, our primary social media venue is LinkedIn. We will be updating that regularly. Please follow us on LinkedIn. And if you have interesting news or posts, please tag us so that we can share those with our followers on LinkedIn. I'm looking forward to seeing you all and celebrating your membership at our annual meeting and forum at the JW Marriott Hotel in Indianapolis, Indiana, from March 13th to 15th, 2026. It's a great opportunity to connect, mingle, learn. There is, for the formal induction ceremony, it's a gala on Saturday night, and we request that you dress formally for that. It's really very, very nice. We have photographers there, and it's a wonderful celebration of your achievements and your membership in NAP. Our registration closes for the NAP Forum on March 5th. Overall, I would like to thank you for participating and watching this video, but I more look forward to seeing you in Indianapolis and interacting with you as you look to pursue your own personal and professional development journey, working interprofessionally with your fellow NAP members. So thank you very much. Have a wonderful day.